Hi, I'm Joe DiMatteo, pharmacist, clinical nutritionist, doctor of naturopathy, co-host of the Len and Joe Ask the Pharmacist radio broadcast, heard daily, Monday through Friday, and also on Saturdays. You can go to our website at lenandjoe.com and find out specific times where we can be heard on XM satellite radio, Sirius satellite radio, as well as some local cities around the country. Talk to you a little bit today about a very controversial and very difficult area, bone health in women. Osteoporosis becoming a huge issue. Probably in subsequent broadcasts, I'll talk to you about what I believe and what Len and I believe is a better approach to dealing with bone health, number one. Number two, how did we get to where we are? Why do we have so many women, even men now as well, with osteoporosis? I'll give you a little bit of a hint. Bone softening is related to poor bone building mechanisms as you're developing and growing in your teens, in your adolescent years, etc. The bulk of your bone mass is built and made then. If I've made minimal and created a minimal amount of bone mass then, I am going to be more prone later on in life. Now certainly there are genetic links to softening of bone, osteoporosis. We know that frailty, we know that size, bone structure to begin with, smaller boned, Northern European, lighter skin, lighter hair, blue eyes, blonde, red hair, definitely seem to have a predisposition to less bone mass and more prone. But I also think that there are a lot of functional issues that are a problem today. Functional, I'm talking about we drink too many sodas, we consume way too much caffeine, we have a diet that is very pro-inflammatory. You've heard me talk a lot about that. Foods that create inflammation. We also eat a diet that is very acid-forming. Too much meat, too much dairy, too much processed foods. Foods that alkalinize you, that are non-acid forming, are going to be vegetables, fruits. So the common theme that we keep talking about, you'll see is a recurrent one, that literally it applies to, in many cases, cardiovascular health, your bone health, joint destruction, joint breakdown. An acid-forming diet will contribute to the negatives in all those areas. A pro-inflammatory diet will not only melt your bones, affect your brain and neurologic function long-term, predispose you to senile dementia, etc., and other diseases, whether it's osteoporosis, whether it's heart disease, whether it is degenerative joint diseases, whatever. But today I want to focus a little bit more, just focus a little bit on the simple fact that we're using medications and pharmaceuticals to treat this disorder, this disease. We're using a class of medications known as bisphosphonates. So as a pharmacist first, I can speak to the pharmacology of that drug. And let's talk about that. That pharmaceutical or class of pharmaceuticals principally do one thing. I'll use strong terminology here. There might be many of you that are healthcare practitioners that may disagree. It poisons osteoclasts. Your body has osteoblasts that literally at a bone level help to stimulate new bone formation. You have osteoclasts that are breaking down. So you have osteoblasts that are building up, osteoclasts that are breaking down. This is called the dynamics of bone remodeling. So your body, my body, we remodel bone every single day. The problem here is when you use a pharmaceutical to specifically interfere with one mechanism, the clast formation, you block that, you take that out of the equation. So now we're just in an osteoblast phase. You're interfering with real-time metabolic activity at a bone level. I believe there's huge problems with that. We stated that, Len and I, in some radio broadcasts we can document all the way back to 2004, we started to discuss the difficulties with this class of medications. So there are the basic side effects. Let's get to that because that was the point of this today. This class of meds can create esophageal erosion. We know that for a fact. It's in the literature. Some of the newer ones now, the idea is to maybe create less of that problem. But nonetheless, that's the basics. But the real damaging issues here are atypical bone fractures. Atypical fractures, subtrochanteric or femoral fractures, which are atypical. Femur fractures, we're talking the largest bone in the body. And there are women that there's documented reports, there's now FDA status on this that you can just go right to the FDA.gov and pull this up yourself. But we have atypical fractures occurring in women that are low impact. In other words, really not doing anything. I'm not talking about jumping off of a 6-foot wall. I'm talking about maybe stepping off of a curb. Maybe at an exercise class. Low impact fractures occurring to the femur. It's significant, folks. They're finding that these atypical fractures are occurring in folks that use this class, bisphosphonates, these bone-building drugs, at a 2.74-fold increase rate versus those that do not use this class of medications. Let's talk about some of the warnings that the FDA issued back in 2008. FDA issued warnings on severe bone pain that are associated with this class of medications. Musculoskeletal pain associated with drugs like Fosamaxes and alendronates and so on, Actonels, in case maybe I haven't been real clear about the individual products. These are bone-building pharmaceuticals, called the class called bisphosphonates. There are individual names, trade names such as Boniva, Fosamax, Actonels. You catch the drift there. The FDA admits that they take days to months to years before they show up. They use the word brittleness in some of the literature, that the bone literally becomes more brittle. So here's what we won't argue. In general terms, can bisphosphonates create, be careful how I word this, an environment that you're less prone to fracture by just increasing the total volume of bone? I would say yes. That word is atypical. That's very, very critical. We're finding atypical, bizarre types of fractures that are occurring. That's the key issue. Low impact. Literature also now documents that it may be interfering with collagen structure and collagen formation. Collagen is involved in bone building processes as well. We know that this process slows what we call bone turnover. Bone turnover is part of that remodeling process that we talked about. So your body has to undergo literally a remodel. You can't have a carpenter come into your home and just start putting up new things that you want without first tearing out what needs to be removed. You can't put in new facilities in your kitchen without first removing those. The old flooring has to be taken out before new flooring can be entered in. Same thing here with your bones. Rates of atrial fibrillation. Literature shows 1.86-fold increase. Some significant hospitalizations required associated with this class of medications. Osteonecrosis. So let's just talk about the atrial fib issues. Atrial fibrillation is a huge issue today. You have to use, in many cases, pharmaceuticals such as Coumadin to reduce the potential side effects that atrial fib brings, which is clots that can be thrown off that can be devastating and permanent problems and difficulties, increasing morbidity and mortality. The last part, I just mentioned osteonecrosis. USC, University of Southern California School of Dentistry, documented a concept talking about biofilms, and these biofilms, that bacteria, when they live in this biofilm arena, this has not just to do with this medication, but other areas as well, that we have a significant link to softening of the jaw, women, men developing fuzzy jaw or osteonecrosis, breakdown of the jawbone, and having any type of dental work done or implants, extractions. You are at high risk for not only for chronic infection in that area, but difficulties in healing and delayed healing times. Folks, in subsequent viewings, I'd like to talk a little bit more about how you can build bone. This was to give you an overview of some of the downsides of pharmaceuticals that are used here. Going forward, we're going to talk to you about more holistic and naturopathic approaches. Thanks for tuning in. Go to the website at lenandjoe.com and or mscompounding.com and learn more about how to build bone.